Patients walk into hospitals every day for elective surgery, for oncologic treatment, for antibiotic treatment, sometimes for acute pain management, say, for instance, for kidney stones. And our standard of care currently requires that we monitor their vital signs no more than every 4 hours. That standard of care dates back to probably Florence Nightingale. We have the technology now to easily monitor patients continuously without being encumbering or without being bothersome to the patient. I am Dr. Frank Overdyk. I'm a professor of anesthesiology. I want to have a conversation about continuous respiratory monitoring on the hospital ward. Patients who are in those hospital beds receive potent medications such as opioids or chemotherapy drugs or antibiotics to which they can have a reaction. And studies have shown that when these patients are found so-called dead in bed, they hadn't been seen for over an hour on average. We have a lack of vigilance, and it's being recognized that this problem of detecting deterioration or decompensation in patients is one of the primary factors why we have this many cardiopulmonary arrests on these ward patients who aren't critically ill or very sick. That's why we have them on a ward. It has been shown that earlier detection is critical in improving outcomes, decreasing length of stay, and decreasing the cost of having to send that patient to the ICU. We need a monitor for these patients that's almost like a piece of jewelry. It doesn't bother them. They can eat, drink, they can go to the bathroom, they can be taken to the radiology suite for an X-ray. And you need a monitor that's accurate. It cannot be giving false alarms all the time because it would drive the nurses crazy and it would be very inefficient and it would be dangerous. All these technical limitations have now been overcome. The real question is, why aren't hospitals doing this if they recognize that's a problem? And then it always comes down to cost these days. But between industry and the companies and the hospitals, from a public safety perspective, we need to be able to get this done. It's a reallocation of resources. It will not increase the burden on the nurses, but it will make a huge step towards preventing dead in bed and earlier recognition of other conditions.